the new Suturelysis lens, which I recently developed for Volk. My name is Blumenthal from Hadassah Hospital in Jerusalem. The new Suturelysis lens provides advantages on both ends of the spectrum. Enhanced visibility in difficult situations, as well as smooth suturelysis in routine cases. It has been said that the success of a trabeculectomy is as dependent on post-operative care as it is on intraoperative surgical skill. During trabeculectomy, an opening in the wall of the eye is created to allow fluid to leave the eye and pool under the conjunctiva in a space which we call a bleb. Sutures are placed to bridge the opening in the eye, as you can see in this illustration. The following video will highlight how these sutures are placed during trabeculectomy to provide precisely the right amount of flow through the opening. In this video you can see the flow through the opening after 3 sutures are in place. In this specific case that I chose, it appears that too much flow takes place through the opening, necessitating the addition of 2 more sutures. Once these additional sutures are in place, the anterior chamber is filled, and again the amount of flow is estimated by virtue of observing how much fluid is leaking out of the eye. Once it appears that the right amount of flow is taking place, the conjunctiva is closed, and as you can see now, a bleb is created and inflated. Suturelysis implies cutting a suture that bridges the surgical opening in the wall of the eye. Suturelysis, breaking of these sutures, results in increased flow out of the eye and lower intraocular pressure. Suturelysis prevents the need for a second surgical procedure. If it were not for this procedure, the surgeon would have to lift the conjunctiva and tenon in order to gain access to the surgical bed. In order to perform suturelysis, the surgeon will need a Suturelysis lens. The laser spot size would be 50 microns, even though in unsteady patients it is possible and even recommended to go up to the 100 micron spot size. The laser energy used is between 100 and 500 milliwatts depending on the visibility of the suture, and the spot duration should be 0.1 seconds. There are 3 ocular Suturelysis lenses, the Hoskins, Mendelkorn and Rich, and recently Volk has come out with this new lens. This is the Hoskins Suturelysis lens, the first to appear on the market. Later came the Mendelkorn and the Rich Suturelysis lens. I will now highlight the advantages of the Volk Suturelysis lens. The first advantage is magnification. The lens magnifies the suture 2 to 3 times, easing suturelysis. The 50 micron spot size will also be seen magnified, promoting a much smoother and more accurate procedure. Magnification is created by the convex front surface of the lens, a surface which is protected from scratches by the metal ring. In this photograph performed through the lens, you can see on the left a line, and in the center the same line magnified through the lens. Visibility is a second advantage. The specially designed tip allows deeper set sutures to be seen with much better clarity to permit suturelysis. For maximal visibility of deeper set sutures, one would need to press firmly with the lens for up to 1 minute, and what you will see is that the suture gradually becomes more and more noticeable. After successful suturelysis, a gap in the suture appears, as can be seen next to the arrow. In this case, you can see that the cut ends of the suture have retracted significantly. While these photographs do not do justice to the view seen through this lens, you should be able to appreciate the 10-0 nylon suture knot. This magnification is usually not achieved with the operating microscope nor with the slit lamp. Another advantage has to do with handling of the lens. The familiar ring design allows easy handling and maneuverability. The lens is held and managed much like any other diagnostic lens. Finally, 2 tips for using the Suturelysis lens. The pointed tip provides a very strong compressive force that increases visibility of the suture and also adds to the stabilization of the treated area. This feature provides particular benefit in patients with a thick Tenon's layer or a subconjunctival hemorrhage. In this specific eye, significant conjunctival hyperemia can be seen. By virtue of compression over the eye, you can see that in the center of the lens, the vessels have bleached. On the right, in the same eye, you can note that with stronger compression, the area of bleached vessels becomes much larger. And last, after finalizing the suturelysis, when the suture is already cut, you can press with the lens and you will suddenly and gradually see the conjunctiva inflating around the lens, indicating that fluid is now filtrating out of the eye. Thank you, and good luck in your next suturelysis case.